Hi there, my name's Jo Gamble and I'm a functional medicine practitioner, and today I've come to talk to you about polycystic ovarian syndrome. Now, this certainly is a imbalance, group of symptoms, disease that I'm seeing more and more clients present with. And sadly, many of those clients come to see me when they are really struggling, particularly struggling to get pregnant. So I thought I would take 10 minutes to talk to you about PCOS. And if you're suffering or you've got a loved one that's suffering, I wanted to give you a little bit of light at the end of the tunnel. Now, PCOS is a combination of potentially a genetic imbalance, certainly a hormonal imbalance, but it's also a metabolic and reproductive disorder affecting women. It affects about 1 in 10 women at some part of the continuum of polycystic ovarian syndrome. Some people don't have this syndrome as part of their diagnosis, they just have polycystic ovaries. And many of these women are presenting with maybe physical characteristics, emotional characteristics, and like I said, fertility characteristics. So we think it affects about 10% of all women. It's one of the leading causes of infertility. And that's what I'm seeing so many clients present to me with. Jo, I'm trying for a baby. I can't get pregnant. And of course, I can support them. I can support them alongside IVF treatment. But actually, if there was work that we could do to recreate balance in their body, they might not need that intervention from a fertility expert such as an IVF clinic, which is incredibly costly and emotionally massively challenging. Early identification and management reduces risk to diabetes and heart disease. PCOS falls under a category of cardiometabolic syndromes and therefore puts you at greater risk of complications with heart disease and particularly type 2 diabetes and insulin resistance. It involves insulin insensitivity and insulin resistance, meaning the pancreas has to work even harder producing more insulin because the cells are not listening to the insulin that's already produced from the factory in the way that it should. And one of the emerging therapeutic targets for polycystic ovaries is to help to regulate those blood sugar levels, which I've had great success with my clients using interventions such as intermittent fasting, so going for longer periods without food, and also using supplementation to help to resensitize the cells to insulin. This includes alpha lipoic acid, as well as using chromium and cinnamon to help to stabilize blood sugar levels. But what I would say is make sure you work with a practitioner because it's so key to get therapeutic doses right to be actually get that level of intervention required to be therapeutic. We can also use things like myo-inositol and therapeutic lifestyle changes, which is a new safe and effective approach to helping with regulation of hormones. So polycystic ovarian syndrome is the most common endocrinopathy that affects women. It's a chronic over androgenic state, meaning and androgens are more male dominant hormones. So women with PCOS produce more male dominant hormones. And this is why often women present with excess hair or spots around their chin line or excess hair on their chest or belly button down to pubic bone. They're very common symptoms. And sadly, many women and young girls are incredibly embarrassed by those symptoms. So don't seek help, but use methods to cover them up. And I would say, please don't be embarrassed. This is part of the pathology of polycystic ovaries. And if we can work to block those androgens and lower the levels, the symptoms of hair growth do reduce over time. So it's more than just about sex hormones. We've said it's a massive insulin imbalance. We know that many women present with acne, particularly around their face, neck, chest, and back. Women might present with acanthosis nigricans, which is a skin disorder where they get darker skin, often under their arms, but sometimes on their neck. And I've also seen women present underneath their breasts with a darker brown to the skin. Hirsutism, which is the excess growth of facial and or body hair in a male distribution pattern. And androgenic alopecia, so loss of hair in more male pattern. One of my clients refers to it as her landing strip has thinned. So it's what we see in more male, or receding hair at the front. So again, that sort of receding hairline that you might see in men as they age. Now, we know that stress is a big factor in polycystic ovaries. Stress can drive the symptoms, but actually the symptoms drive more stress as we get more stressed about the symptoms. So we don't need to argue that stress may be an important precipitating factor in polycystic ovarian syndrome. Under stress, production of cortisol releasing hormone increases, stimulating the release of cortisol and also that of androgens. The high cortisol then leads to elevated blood sugar levels and in turn excessive insulin secretion. Long term, the cocktail of cortisol and insulin can lead to further production of androgens, so upregulating this cycle, central adiposity, that's visceral adipose tissue, fat around the middle, and the development of metabolic syndrome. So what sort of things can we do to reduce stress? Spend time with nature, stimulating our vagal nerve, and we can do that by laughing out loud, humming, singing out loud. These all help to rebalance our vagal nerve, which helps to lower our stress response. Spend time with the right people. You know who those people are. People who actually make you laugh, show their care towards you, and don't necessarily drain you in the way that some people can. Focusing on sleep hygiene, optimizing 8 hours of sleep a night. Be creative, get out those coloring books or the jewelry making kit, the knitting needles. These all help with reducing stress. Yoga, meditation, mindfulness, these are all free. You don't need to be able to go to a class to do yoga. There's some phenomenal yoga free on YouTube. We also really need to focus on blood sugar balance. You can see my plate on the screen. 50% of my plate is non-starchy vegetables. 25% is good quality protein, 10% healthy fats, and that left me with only 10% of grains, as well as 5% of concentrated nutrients. This is things like your turmerics, your gingers, foods that have got really good therapeutic anti-inflammatory benefits. Green tea is another one I'd put in that concentrated nutrients for my clients with polycystic ovarian syndrome. Green tea actually helps to block 5-alpha reductase, which drives the androgenic patterns within our body. Now, if you think of a typical Western diet, more than 50% of a plate is generally carbohydrates and often refined white pasta, white rice, white potatoes. For us, we need to reduce that percentage right down to 10% of complex carbohydrates. That might be your brown rice, your sweet potato, but 50% of this plate is non-starchy vegetables. I also encourage my polycystic ovarian syndrome clients to fast between meals, i.e. no snacks. So breakfast, lunch, and dinner. And if you've got really stubborn weight loss, lunch and dinner, or brunch and an early dinner would be best for you. Exercise. We need to help our cells become more receptive to insulin. When we exercise, we activate a little transporter, it's called our GLUT4 transporter, that grabs hold of the glucose and takes it into the cells. And this is why we should be aiming at short, sharp exercise intervals on a daily basis. 10 minutes a day, 7 days a week is much more effective than an hour once a week and then nothing for the other 6 days when we're trying to support insulin resistance. Now, there's many therapeutic foods that we can also utilize for clients with polycystic ovarian syndrome. Cinnamon helps to stabilize blood sugar levels. Walnuts are rich in omega-3, which is anti-inflammatory. We've also got nettle as well as green tea. Nettle tea helps to block 5-alpha reductase and also supports liver detoxification. Now, one thing many women get benefit from is seed cycling. In this instance, we introduce 2 dessert spoons of ground flax seeds in the first half of the cycle and 2 dessert spoons of sesame seeds in the second half of the cycle. This helps to support estrogen in the first half and progesterone, which is often very lacking in clients with polycystic ovarian syndrome in the second half of the cycle. And something I find invaluable for my clients with polycystic ovarian syndrome is testing their hormones. Now, yes, you can go visit your GP, but GP will regularly do serum testosterone, and we can usually get sex hormone binding globulin and HbA1c, which looks at your blood glucose level over a 3-month window. And they are really useful. But we do actually need more than that. And you can see in this diagram that I've got on my screen right now, it is this all-important aromatase that converts testosterone to estrogen. And also it's this 5-alpha reductase that converts to androsterone, which is the most common excessive androgen we see in polycystic ovarian syndrome. But we also need to ascertain what's going on with your progesterone levels. And progesterone, as well as helping to regulate our menstrual cycle, and if we're pregnant, keep us pregnant, progesterone also is a zen hormone in the body. So therefore it helps to oppose the effect of stress. And we've said stress upregulates polycystic ovarian syndrome. So I work with my clients all the way through their PCOS journey to ascertain where their unique imbalance is and work to regulate their hormones. If you've got polycystic ovarian syndrome, you might want to start your functional medicine journey and really start to make a difference. I hope this has been useful for you, and I wish you all the success in your PCOS journey. You take care. Bye for now.